We're sitting with Dr. David Klein, and we want to talk about mental illness in children.
Well, it's got to start sometime now, doesn't it?
Yes.
Okay, now arguably every parent, okay, is going to think that their little junior, okay, is perfect. Until they do something not so perfect, in which case they just want to beat the crud out of them or discipline them in some manner. But the fact of the matter is, kids get into trouble, kids are imperfect, kids do the best they can when they feel like doing it, and the rest of the time they do what they feel like doing. But mental illness is something a little bit different, and it starts as a child. You know, you can have schizophrenia as a young adult, but you don't typically find schizophrenic adults that didn't have peculiarities when they were kids. You don't find bipolar adults that weren't mentally ill when they were kids. Well, they just have anger management issues. And then as they get older, it becomes more and more obvious. Individuals with substance abuse potential will show as kids. It happens this way. When you have anger management problems, it's very, very frequently a predictive factor with regards to development of more serious illnesses later. Lack of taking personal responsibility. We have our opportunities when kids are young. We should take advantage of these opportunities. Well, the first thing, okay, is what is it that makes a kid crazy? What is it that makes a kid mentally ill? Are there things that we can do to improve their chances? Are there things that we can do to make them healthier? And the answer is oddly yes. The brain is not fully formed until the child hits about the age of 22 to 24. So the brain is not as it is at an adult age as it is when you're an adolescent or a child. You have an opportunity. The first thing you want to do is to keep your kids away from trauma. Why? You end up with a closed head injury. They end up a little bit different. These sports that we have kids going through right now are very, very dangerous with regards to the developmental issues that will happen later on in life. You end up taking hits on the head. It's not going to make you smarter. Okay, taking hits on the head in football, soccer, and so forth do not make a bright kid into a brighter kid. You can't smack sense into them in the traditional sense. Okay, so trauma is something that you can in fact influence. You can try not traumatizing your kid. Shaken baby syndrome is very, very interesting. You have a small child, they cry. You know that? It's very weird how that works. They can't really communicate effectively, so what do? They cry. A significant number of children suffer brain damage as a result of being shaken hard by their parent. Like that's going to make them stop crying. Eventually, every child will stop crying if you shake them hard enough. Okay? That's frightening. Okay? So we can traumatize our kids physically. But what can a kid do to traumatize himself or herself? And this is the thing that you can influence most directly. And it's going to start with their cell phone. It's going to start with their radio. Back in the day, it was the radio and television. I remember those days vividly. Turn off your TV. You're going to sleep right now. But it's 11 o'clock, time to go to bed. And if you didn't, you got the TV taken away from you. The phone, well, that was down in the kitchen. You didn't have it up in your room, so you really didn't have to worry too much about that. But things changed. Not for the better either. They changed all right, and now kids are going to sleep with their telephones. Okay? The really bad kids go to sleep with other kids. Okay? But going to sleep with your phone is a big, big problem. Why do you suppose this is? Because the darn things make a lot of noise, especially when some other kid who can't sleep is now calling your kid who's not going to sleep to commiserate about some ridiculous event that occurred at school or someplace else. By inducing lack of sleep, you increase the chances of the kid becoming depressed. Inability to focus, inability to get their job done at school. Their job is school. Your job is to create a home environment and to make enough money to feed them. Their job is school up to the age of about 18, and after that, it all depends on what is in store for them, whether it's more school or whether it's going out to work. But if you train your brain not to turn off at a predictable time, that time should be 9 or 10 o'clock at night, and get a good 8 hours worth of rest, you are going to induce predictably mental illness known as depression. It happens to everybody. If you deprive any person of sleep, depression will follow. You need to identify this. Now, what can we do as parents with regards to identification of the odd kid? None of these children that are going there shooting up the school were not identified as being a little bit off-center before the event. If you go back and look at it, there were all kinds of signs and symptoms that should have been addressed. What did the parents do? If the parents were passed away, they might be held blameless, but it's not typically the case. Typically, the parents look the other way while the kid is killing cats in the backyard. Typically, they're looking the other way when the kid has temper tantrums and breaks the house up. Being expelled from school is a pretty good indicator that there might be something going on, because nice kids don't typically get expelled from school. Does it happen? Yes, it happens. But you can, in fact, influence this behavior. One of the things that I find most disturbing, is the misdiagnosis of mental health illness in kids, because most of these things are, in fact, treatable if they're addressed properly. Bipolar illness is something that's very near and dear to my heart. One of my family members suffers from this, and my experiences as a young child, were influenced by my eldest sister, who basically beat the crud out of the rest of us, and it was a great day indeed when she left, She remains that way to this day. I hope she's not listening in, or maybe I do hope she's listening in. Either way, bipolar disorder does in fact occur in children, and these problems that people have with anger management issues, you need to take a fresh look at it, because bipolar illness in children is treatable, and it is not particularly difficult to do it, and it doesn't stunt their growth. Giving a kid that has an attention deficit disorder, quote unquote, diagnosed by a school teacher and confirmed by somebody with a bachelor's degree in psychology, isn't likely to end well for anybody as they get older. Bipolar illness is not to be laughed at, and it's not something that's all that unusual. When you treat it, things start to do better for these kids. It's remarkable how well it goes. Now, as it turns out, with kids, they do change. As they get older, their chemistry changes. Their medical needs are going to change, and they need to be adjusted. It is not something that can't be done, but it needs to be looked at. We end up with a lot of kids that are told that they have ADD and OCD, and now we have a huge crop of kids that are a whole lot shorter than they should have been, because oddly enough, the amphetamines do inhibit growth, height. They will become height impaired as a result. But it also does other things to the pituitary gland. It changes the way their body chemistry reacts hormonally. So giving a kid Adderall, giving a kid a Ritalin or D-amphetamine, whatever it happens to be, whatever bottle is in front of them, isn't going to do that kid much good for very long. Bipolar illness is one that's easily treatable. ADD is one that's overdiagnosed.
You hear about that all the time. You hear about teachers and even schools getting grants the more kids are on Ritalin.
Oh, you betcha. It's a little scary, isn't it? So when the teachers make the diagnosis of ADD and they get sent to whatever clinic they go to so they can get their Adderall, the schools get paid more. But this is also an interesting opportunity, because under Florida state law, these kids are supposed to be urine tested for toxicology every time they get one of those class 2 narcotic prescriptions for the amphetamines, right? So if you think little Johnny has a drug problem, you have 12 opportunities per year to detect it. Now, I've been doing this a long time. I don't know any pediatricians that do urine toxicologies on these kids, which is something that's state mandated. I don't know too many psychiatrists that are doing it, even though it's state mandated. Very interesting piece of politics, very, very interesting piece of preventive health. You end up with a kid that pees positive for methamphetamine. That's always a problem. But where'd the kid get the benzodiazepines from? Well, from mommy's sleeping pills. Where did the kid find the barbiturates? Well, from sister's seizure medication. Where'd the kid find the marijuana? Probably from another kid in school. These are the things that you need to know, because they do lead to other issues. So what do I think? I think mental illnesses in kids is tremendously understated. Now, one of the odd things that's coming of these recent school shootings is they're talking about denying Second Amendment rights to people that have mental illness in their history. And it sounds like a really, really good idea. I mean, how bad could that possibly be if somebody has one of these anger management issues that they should be on some kind of list? Well, I'm not so sure that it's such a great idea. I think that there are responsibilities. I'm not sure who the responsibility belongs to. But if 1/3 of the population has been treated for depression at some time in their life, this can give the government an opportunity to disarm 1/3 of the population, making it impossible for them to defend themselves. I'm not so sure that that's the price I want to pay personally. Or it ends up something like this. Well, gee, if I get treated for my depression, then they're going to take away my X, Y, and Z. I won't be able to hunt, I won't be able to this, or I won't be able to that. And that's probably where this is going to end up being argued, right there.
To learn more about the doctor and his practice, suffernomore.com, suffernomore.com. And if you take nutraceuticals, you want to make sure you're getting the right nutraceuticals and that you're taking them in a regimented way. Stagesoflifevitamins.com, stagesoflifevitamins.com.